This conference will now be recorded.
Okay, we are going to record this session, so a link to this recording as well as handouts and any information will all be mailed out next week. If there are questions that we're not able to get to in the Q&A, if we run out of time for those, we will go ahead and email those next week. Sorry, once again trying to multitask and I don't do that well, as you can tell. Before we get started, I'd like to recognize our sponsors again, United Access, Quantum Rehab, Maxim Healthcare Services, Permobile, New Motion Foundation Ability Center, and Bayada, and we really appreciate all of their support. So thank you for that commercial break so we can recognize them. If you haven't seen our Facebook this week, there were presentations from multiple of those, so please go on and like their stuff. So we're going to get started. Ann Ross is our next presenter. She received her Bachelor of Science in Dental Hygiene from one of the top accredited programs at the University of Iowa in 1991. She's practiced dental hygiene for over 25 years in various settings in Iowa and Arizona. Through many years of practice, Ann's developed a particular interest for the aging, less fortunate, and vulnerable patients. In 2008, Ann pioneered a mobile practice that could serve people with all different physical and cognitive concerns. Thus, Mobile Dentistry of Arizona was formed. So, Ann, I forgot to put that up, but we welcome you and we appreciate you for giving us your time and expertise today, and I'm going to go ahead and undo this slide and I'll let you take over and share your screen. We couldn't hear you at first, but I think you're unmuted now.
Okay. Are you able to see the screen, Amy? Because I can't see you anymore, just the screen. So that might be correct.
No, we can't. We cannot see it. But I do have your slides as well, so if there are issues and you want me to just click through, I can do that as well.
Okay, let's see. I'm going to go back out. Can you see my screen now?
No, you'll have to hit share your screen.
Okay, just a second. I'm not sure what it did here.
Oh, it didn't make you when I was presenting, it took away your presenter rights, but now.
Okay, that's okay.
Now we can see it.
I'm just trying to get rid of that. Can you see the highlighted box?
Yeah.
Wonder how to get rid of that. Anyway, I'm afraid to X out for what it might be.
You can try it if you want. We'll hang with you.
Oh boy. Let's see here. I'm not sure how to shrink it here. Now we need Mark, don't we?
Yes, we do.
Collapse. Let's see here. Looking for those icons.
You may have to stop sharing your screen first to be able to see those, because sometimes it hides things from me.
That very well could be.
Or maybe out of that presenter mode. Or if you want, I can just pull up the slides. You'll just have to tell me to click through.
We can do that. That's too bad. Okay. All I need to do is collapse it, but I'm clicking on collapse, but it's not doing it. So.
Okay. Can you unshare your screen and I will take over?
Yeah.
Thank you for your patience with our technical experts.
Okay.
Okay, so
if you can.
Yep, I'm pulling it up right now and then I'll share.
There we go. Are you able to collapse it?
Collapse what? Can you guys see it? You should be able to see. Yes, I'm getting some thumbs up. Okay.
That's fully enlarged, so everybody
Yes.
can see it okay? Okay, so it's off my screen. I'm not sure what happened. That's really, really interesting. But anyway, I am not able to see the screen, just one small portion of it because oh, there we go. Perfect. Let me try. Anyway, oral care, it's more than a mouthful, and it is. We've got lots of teeth and gums to talk about. Thank you, Amy, for letting me come and share on a Saturday afternoon. I couldn't think of anything better or more exciting to talk about. One of the reasons I chose, or the main reason I chose to become a dental hygienist, was my passion for caring for people and my mission to help make their lives better. Thinking out of the box is what I've done over the last 14, 15, 16 years in creating a mobile practice, which we will share here with you, and developing lasting relationships with people, patients, communities to help make their lives better and their oral care and their oral health healthier. So, who is Mobile Dentistry of Arizona? Some of you may have seen us driving down the freeway, driving down your street. Some of you may have experienced our care. But basically, we are a dental office on wheels. We actually come to you. We drive to our patients for their appointments, one at a time. We have a full staff, office equipment, dental equipment, high-tech equipment, just like a traditional dental office or brick and mortar office. And believe it or not, back in 2008, I got this crazy notion to take my care to my patients because I was noticing in private practice, some of my patients weren't coming back to me. They were aging, or maybe they were going from a walker to a wheelchair and having a lot of different challenges getting into the operatory. A lot of traditional offices are not geared towards working with different types of folks and challenges. And this is something that I picked up on. And sometimes dentists are not familiar with all different kinds of challenges. And so I really felt there was a need. I wanted to be that one. I knew I could be that one and assist people in this way. And so far, it's been wonderful. And you can see on this picture, we've got a good part of our staff, a couple of our vehicles. We now have 3. We service 4 counties, Maricopa County and surrounding cities, Yavapai County, Pinal, and Pima here in Arizona. I want to show you a few pictures, and I want to also disclose that I have consent to use all of these different photos. People have been more than happy to help me, allow me to share in an educational sense with my in-services. You can see one of our dentists. We have 3 dentists, 3 hygienists. I am a hygienist myself and a provider. I provide obviously dental services, administrative, educational services as well. And you can see on the upper right, we have a gentleman that was more than kind to allow me to demonstrate taking his dentures in and out and denture care with a group of caregivers. And this is something that I truly love doing because I feel like I need to share this information with people, because if you don't know, you don't know. And dental hygienists are very good educators. We love to talk, and we love what we do. A couple more pictures of myself and staff. We do have certified medical lifts on our mobile offices. Trained staff. I spend a lot of time working with staff, whether it's with safety protocol, dental procedures, working with people that have different special concerns. And we do have a lot of fun, believe it or not. You know, not everybody wants to go to the dentist. You know, some people are a little bit nervous or phobic. And I can say I get a little bit nervous in the chair, but Dr. Hank does a great job, and he's very quick. He's very efficient. So for me, if I'm nervous in the chair and I need a tooth worked on, I want it over with quickly. Some people want more educational information at chairside. Some people don't even tell me about it, just get it done type of thing. So we do try to accommodate all people's needs. I think we're very good at it. We work in a small space, but we're so used to it. We see one patient at a time. And again, we are mobile, so we go to our patients, to their homes or where they reside or where they work. This is one of my favorite jokes, because I don't know about you, but most people feel like when they go to the dentist or dental hygienist, they get hammered about flossing. I do talk to my patients about flossing, but I honestly understand it's difficult, it's cumbersome, it takes a lot of dexterity, and frankly, a lot of people don't like to floss. So we're going to talk about some alternatives to flossing. If you've ever heard of a water flosser, they used to be called a Waterpik. Waterpik is a brand name for a device, and we're going to talk a little bit more about this in the presentation. So anyway, I promise I won't hammer anyone. I'm here to find solutions for people and to care for them, not to beat them up about what they haven't been doing or the last time they've been to the dentist. So we all share similar goals, and we want our lives to be full and healthy, comfortable. Certainly we don't want oral pain, right? That's what we're here for. And I can see over the last 14 years, we have cared for lots of folks very successfully in a repeated fashion, and enjoy it very much. Oral health, obviously our mouths, our oral cavities are linked to the rest of our body, right? So we know that our mouths can be considered a window or a portal to the rest of our bodies. So what we put in our mouths enters our body. Our organ systems, our circulatory system goes through our heart, obviously. If we have dirty teeth, if we have a lot of plaque on our teeth, that also enters into our body and goes throughout our system, our veins, our arteries, our vessels, and our heart. So you're going to be hearing me talk a little bit more about systemic concerns with not maintaining our oral health. But adults not only require good medical care, but also dental care. So we need dental care, obviously, in our lifetime. We need to have good oral care and good oral health to remain healthy. So despite abundant resources, sometimes we fall off course, right? It happens. I can say I've put off my last oil change in my car. Probably not my teeth or my checkups for myself or my family. But again, we're all human, and we all have our checklists, and sometimes these things happen. So what causes these things? Well, maybe we forget, maybe it's just not something we want to think about. Maybe we've had something occur, a medical condition, maybe we've relocated. I know I've moved this summer, and I think that's been very disrupting to me and my family. So I have a good excuse. I want to share a picture about Pat. Now, Pat had a stroke a few years ago. She's not able to articulate her needs or really explain that she's in pain. Certainly because you can see a swelling on her left side, her lower jaw. So I did get a call from her husband, who is her primary caregiver, and he did notice the swelling on her lower left jawline, and she was not eating like herself. She just didn't seem like, she didn't have that sparkle or pizzazz. And so she was kind of pushing food away, and he thought, oh, I better call the dentist. So he called, we went to see her, and lo and behold, she did have a large infection. So my message to you is, just because you don't feel pain, just because you don't have a toothache or a swelling, doesn't mean there may not be a concern. Obviously, being a dental hygienist, I'm very proactive with prevention. I preach prevention because an ounce of cure, that little sing song, an apple a day keeps the doctor away. Same thing with prevention with the dentist. I feel like we can keep our dental bills down and stay healthier when we do practice prevention. We have a lot of risk factors, and there's some obstacles of poor oral health. So these are some things that can come into play that can impact our oral health and, again, our systemic health. Some of which are dental diseases, which we will talk about with the teeth and our gums. Growing older, as we age, we tend to acquire a few more concerns medically as well as with our teeth and our gums. I think we acquire more time, we gain more time with some of these concerns. Poor oral hygiene, we know obviously can impact our health. Poor diet, we obviously want to take in nutritionally sound foods. Now, I don't know about you, but I have a sweet tooth, but I try to monitor what I eat and what I drink. Certainly, a lot of those things can play a negative factor for our oral health. A dry mouth certainly can be caused by a lot of different things. The word for dry mouth is xerostomia. And also hyposalivation would be the lack of producing saliva in the mouth. Saliva is definitely needed to help keep us healthy. It actually can help buffer acids that are produced by bacteria. So we're going to talk a little bit more about dry mouth and how to overcome that. Infrequent dental visits, obviously, if we don't visit the dentist, if we don't have our teeth cleaned, this can be a big concern. And visiting a dental professional can help identify small concerns that can lead to bigger concerns. And certainly we don't want that. Limited access for care, that can be a challenge with folks with ALS, people in electric wheelchairs. It just can become or feel overwhelming, you know, with transportation and with getting in and out of a dental office and around the dental chair. In our mobile office, obviously we come to you as a convenience. We're able to actually push the dental chair aside and wheel an electric wheelchair or standard wheelchair in place for care if needed. So we have a lot of flexibility that way, overcoming these obstacles for access. If we have an individual that's developing dementia, that can be a big factor because they may not want to care for themselves. They may not be cooperative. They may not remember, even though they may have cared for themselves on a regular basis through their lifetime. Lack of education. So some people have grown up with oral care, with dental appointments, certainly, and some have not. And I would say that our silent generation, our boomer generation have, for the most part. My mother did, maybe not every 6 months faithfully, but I believe that her mom and dad made sure she got to the dentist. And yes, she had dental problems, just like some of us, but certainly if you are educated, I think that does make a difference if you understand the ramifications of not maintaining. Lack of oral health care coverage, certainly that could be an issue when it comes to cost because dentistry can be expensive at times. So that's something that we want to consider. If someone does need coverage, they can get an individual policy, and we'll talk about that here in just a minute. A weak value system means if someone just doesn't want any part of it. Well, I didn't used to go to the dentist and I have perfect teeth, so I'm not going to go. That can be really difficult to overcome. However, a lot of folks have had care through their lifetime and obviously appreciate that and they want to maintain. If they're not able to articulate that, it is up to maybe a family member or power of attorney to help make sure, maybe a caregiver, to make sure that they're getting their needs met. And this also includes their oral care. Tobacco use, we know, can be not so good on our bodies and our oral health. It can cause oral cancer. And certainly there's a lot of publicity about that and some cessation programs that I can help people with, as well as systemic diseases. If we have poor oral health, it can cause our systemic concerns to become worse. So we want to maintain our oral health at all costs. So with dental diseases, considering our teeth and our gums, we know that they are infectious and communicable. So we don't want to think about that. We don't want to think that the person sitting next to us is going to give us a cavity or gum disease, but we do know that we acquire the germs from somewhere, from someone. But be rest assured, you already have these germs. The germs that cause tooth decay, there's very, very few in our mouths. And the same thing with gum disease. There are 4 or 5 different germs that cause gum disease, but we already have those as well. It's really up to our bodies if we acquire or develop these problems. So a lot of what we do as far as frequency of dental visits, keeping our teeth clean and maintaining will have a whole lot to do with the outcome and what we suffer. So I just wanted to show you cavities. Gum disease obviously seems to be the buzz anymore because the germs that cause cavities don't seem to have as big an impact on our bodies systemically as the germs that cause gum disease. So the germs that cause periodontal disease definitely do impact our heart health, our circulatory system, our organ systems, and more, and our heart valves. So these are the bugs, these are the germs that we really go after. Abscesses and infections, they can lead you right into the ER. We don't want that. So again, with periodontal disease, we talk a lot about gum disease in dentistry because it is a big deal. This is one of our main concerns. We can fix a tooth very easily. We can replace a tooth if there's a big cavity or it needs to be removed. But with gums, this is a big deal. It's something that we can maintain, but we can't get rid of. We basically can't get rid of it. It's like if you develop diabetes, you have it for life, right? Same thing with gum disease. If you are diagnosed with gum disease, we can treat it and we can maintain it, but we can't completely get rid of it. So it is important to maintain. It does cause destruction around the supporting structures of the teeth, the ligaments, and the bone down below. That's what causes the teeth to become loose. So about 23% of people aged 65 to 74 have several areas of gum disease in their mouth, and about 30% age 65 and over have lost a good share of their teeth due to gum disease. So when I see a patient in my chair and they're missing a lot of teeth, I start asking questions about how and when and things like that. It's typically due to gum disease. A lot of studies show well-established links between periodontal disease, heart disease, diabetes, etc., even obesity and other systemic concerns. Researchers do believe that inflammation, I'm sure you've heard that word before, it's a common denominator that links periodontal disease with other chronic diseases. Other risk factors, age, like I mentioned, not maintaining your hygiene, genetics. Genetics was once thought to be a big part of this disease process, but now it's considered a smaller part. Lifestyle choices and maintenance, so your oral hygiene seems to be a bigger factor now. Smoking doesn't help things, and poor nutrition we know doesn't help either. So abscesses and infection, this is a lady that her daughter called me late in the day. We noticed a swelling. She had pain, she could tell us. But you know, sometimes people with ALS or dementia have difficulty communicating, or they can't communicate about their mouth pain. So once again, prevention is great because we can head off some of these concerns early on when they're tiny, so people don't develop abscesses and pain. If it's left untreated, obviously you've got to go to the ER. Typically you're prescribed antibiotics and pain medication, yet you will ultimately need to see a dentist for care. It won't completely go away. It will temporarily improve, but the abscess won't completely go away. And again, growing older studies show that as we age, we acquire more dental diseases. It was once thought, sometimes people think that as we age, we're definitely going to lose our teeth, and this is not necessarily the case. Sometimes just life happens and we have problems with our teeth. Teeth can be very unpredictable, and so can the gums. Studies show that as symptoms progress for individuals, they tend to need more assistance with personal care, which includes oral care. Obviously, our patients we see have challenges with dexterity, with fatigue. I don't know about you, but when you're really tired, probably don't feel like brushing and flossing your teeth. You're exhausted. Remembering to do this. Depression. I've had patients that just don't want to care for themselves. They're able to, but they don't want to. They're not feeling up to it. Cooperation level. Lack of commitment, they just don't see the need, they don't see the importance of it, and that goes hand in hand with being educated. You can see one of our dental assistants, this was before COVID days, well before COVID days, caring for a lady. She does have gloves on, they're clear. We do offer an in-home oral care program. We do see our folks once a week for additional oral care at a nominal fee. This includes a custom program where we brush, floss, and apply medicaments, whether it's fluoride or something else, to help maintain the teeth and the gums. We've noticed amazing results with this over the years, and I think I have some other pictures of folks that have been on the program I'll show you. But again, you know, maintaining our health will definitely help prevent additional chronic diseases. Poor diet and malnutrition, believe it or not, as we age, we tend to develop a sweet tooth. If you don't have a sweet tooth, consider yourself lucky. I do, so I fight that. We tend to have a sweet tooth and sometimes go for that not so nutritionally sound food, which is not as good for us. If adults have oral disease, they may not be able to consume high nutrient value type foods like crunchy fruits and vegetables. That can be hard depending on what you can eat. If we overeat, we gain weight. That can cause a factor with periodontal disease as well as dentures fitting. That could be a problem. Conversely, if we lose weight, we can have issues with dentures and partial dentures fitting properly. And you can see on this picture, there's a sore spot. So I had a lady that wasn't eating. The nurses called and didn't know what was going on. And I was able to take an intraoral shot and see that she had lost weight. She wasn't doing well. And therefore it was causing some additional rubbing on her gum, and that was really unfortunate, but we did take care of that with an adjustment so she could eat. Dry mouth is a big concern of people of all ages. Definitely as we age, we're sometimes taking in more medications. There are hundreds of different types of medications that can cause xerostomia or dry mouth. One big one would be beta blockers, high blood pressure medications, antidepressants, and some antipsychotics. So a lot of folks do take antidepressants and they do tell me their mouth feels really dry. It feels like cotton. Well, what's happening is it's causing hyposalivation. So if you're not able to produce enough saliva in your mouth, it can be a big problem because saliva has natural components that buffer acids that bacteria produce. So we always have bacteria growing in our mouths 24/7. Even after a dental cleaning, within 20 minutes, the plaque starts to grow again. So our job is to continue to keep our teeth clean as best we can. Saliva helps buffer acids, provides antibacterial, antiviral, and antifungal properties to keep us healthy. And again, it's buffering acids. Radiation and chemo can also play a big role with dry mouth. Infrequent dental visits. If you're not visiting the dentist, we're not able to identify these concerns for you. I just wanted to show you a picture of Mary. When I first met Mary, I noticed she did have some dementia. She was not able to care for herself. Beautiful teeth. When I talked with her son, he definitely wanted her on our weekly program. And believe it or not, over many, many years, she maintained on our weekly oral care program and regular checkups and cleanings. And I don't think we provided any other dentistry for her. So again, this program is very successful, very, very helpful for people. And again, oral care falls under personal care that would be either maintained by that individual or caregiver. Limited access for care. So some of the challenges could be physical and it could be cognitive. This in this instance is physical. Only about 50% of the population in this country goes to the dentist. I believe for our senior population, it's about 40%. And I think now, due to COVID concerns, I think it is much less. I would probably say 20%, because going out to the dentist and being around lots of other folks is a concern across the board. About 23% of older adults have not visited a dentist for 5 or more years. And we notice that because when we talk with our patients on the phone, we like to get an idea what their care has been in the past. But with physical limitations, people have a lot more difficulty obtaining care at a traditional office, like I had mentioned, a lot more obstacles, not as user-friendly. But some factors that make access difficult would be wheelchair access, patient size, certainly that can be a concern, motorized scooters, manipulating the scooters, and transportation to and from offices, as well as waiting room stress. So being dental phobic is real and it is common. So if you are nervous, if you have anxiety, that's something that we can help you with. That's a very common concern. And we don't want that to be your main obstacle in receiving care. Again, developing dementia can lead to many challenges with willingness for care, refusal, not being able to care for themselves. And again, caregivers do find challenges with having enough time to adequately help people with their oral care. Lack of education. I think patients, they may not be thinking about oral health or the ramifications. It's one of those things, well, I'll get to the dentist, I'll make that appointment soon. Families may not be thinking about that either. They're thinking about other medical concerns, other challenges, other things on your checklist. Communities where people reside, I think they need additional oral health programs and protocols, in my opinion. And caregivers may need some additional education, which is definitely something that we can help with. I found this very interesting, but according to recent studies, caregivers average 16.2 seconds for assisting a resident with their oral care. So if you think about, if you have a child at home, how much time would you help Susie brushing her teeth and flossing? Definitely more than 16.2 seconds. Same thing with ourselves. You know, most electric toothbrushes, they have timers, 2-minute timers on them. And that seems to be a good average for people spending time brushing their teeth. Lack of oral health coverage, that can be a definite concern. Again, dentistry can be expensive. The longer we put it off, it seems the more concerns we have and the more expensive it becomes. We do have Medicare and Medicaid. We have the 2 public health insurances that people can utilize. There are individual policies that people can get, but again, if you do practice prevention and get your checkups and cleanings at the interval that you need, it will make a big difference for you. A weak value system, again, commitment. People are committed and they understand the needs. They're more likely to follow through, which will help prevent infection, pain, and so on. We also want to preserve our dignity, and that's something I haven't mentioned, but you know, when you think about oral health, you think of a beautiful smile, you think of teeth and things like that. And this is a lady, believe it or not, Mary was a Vogue model back in the day. Wonderful lady, got to know her and her family, and her son wanted me to care for her on a weekly basis, which I did. She highly valued her teeth. She was a beautiful lady. And you can see that the lower picture there, how healthy her teeth and her gums were just by me going to see her. And she had dementia, so she wasn't able to care for herself. So I worked with her caregivers to help assist during the days I wasn't there. And then I was visiting her once a week along with regular checkups and cleanings. So again, the family highly valued her oral health and her wishes as well. Tobacco use, we know, can cause a lot of systemic concerns, oral cancer, and susceptibility. It just doesn't help anything. But we do have really great cessation programs here in Arizona. If anybody is curious, I would be happy to help in that way. This is a graph. It's pretty basic. It's very straightforward, but most people would rather enjoy health versus many, many years of struggling with poor oral health. So again, chronic diseases can make a big impact on our happiness and the quality of our life. So conditions like high blood pressure, heart disease, cancer, lung disease, diabetes certainly is very common in this country, pre-diabetes, and Alzheimer's account for a good share of our medical costs. Again, heart disease, #1 killer in this country. Atherosclerosis is very, very common, and it can exacerbate with the plaque that accumulates in our mouth. And I really did not know that until many years ago when I was taking a class and learned that the plaque on our teeth that build up, the bacteria can dislodge and go into our circulatory system and lodge in our vessels. So this is something to really take seriously. Lung disease, obviously, if you're aspirating germs from our oral cavity, it can go straight into the lungs, and that's a big problem with developing infection for people, especially if they're not able to swallow well. So that's something, again, keeping in mind, maintaining your teeth. Dementia and Alzheimer's disease, obviously this can be connected. We see lots of studies with poor oral health and inflammation as well. Malnutrition, we know that we need to maintain our nutrition. We need to eat nutritionally sound foods to keep our bodies healthy. And with obesity, obviously we need to maintain what we're taking in, because we know that's also influenced by poor oral health and some of the foods that we eat. Cancers, we know that pancreatic cancer can be influenced by poor oral health and some of the bacteria in our mouths, as well as other cancers now. This is a joke I wanted, not a joke, this is a great picture. I don't know if any of you have ever visited Mount Rushmore. These guys have the most amazing oral care. Look at those shiners. I should say chompers, right? So I'm not here to sensationalize, but honestly give you a message that Obviously, healthy teeth and gums are not only to look nice and have our dignity, but we really need them for our health. How do we overcome this? You know, what types of things can we do to make our lives better and our health? So we can improve, obviously, our oral hygiene by increasing the frequency of dental visits. So not everyone should go in twice a year. You know, Procter & Gamble started that little sing-song of going to the dentist twice a year. I think I mentioned an apple a day keeps the doctor away. We don't really know where that came from. We really don't know. But what I can tell you is everyone has different needs. So there's no cookie cutter plan for all of our patients. We like to address the patient's needs individually. So for myself, I need 3 to 4 cleanings a year to maintain. I tend to build up tartar. Someone else may be twice a year, and someone else may be 3 times a year, for instance. We can improve our diets. I think I'm in that category as well. I'm always trying really hard. Increasing access for care, possibly seeking mobile care if going to the dentist gives you anxiety or if it's just too big of an obstacle. Increasing dental education, that's why you're staying tuned with me to learn a little bit more. Obviously, if you have any questions, I can help you in any capacity. Assisting residents with dental insurance coverage, I can do that. There are a lot of different coverages out there. If you do need that, you may have it through your medical. There may be an additional rider through your medical that you can look into. And we want to improve our value and commitment. I want people to understand why we want to preserve our oral health, not only to have great looking teeth and gums and prevent pain, but we want the rest of our bodies healthy too. And providing tobacco cessation programs is something that I can help with, or the ADA here locally. So this is a PDF. I think I sent that to you, or Mike sent that to you, Amy. This is very basic, but it's needed. I feel like a lot of times I hear people tell me, oh, I don't need a checkup or cleaning. I have perfect teeth. Or I was just in last year, I had no issues, so I don't need to go right now. And these are the questions that I like to ask people or families, because it becomes very apparent if someone needs additional help. So the first question is your loved one able to thoroughly brush for 2 minutes twice a day? Okay, so that could include flossing, but can they brush their own teeth? Yes or no? Often I hear the word no. And so then we know, okay, are they getting assistance? What type of assistance do they need? What type of interval? Number 2, can your family member effectively floss each day? I don't know about you, but flossing is very challenging. Flossers are helpful, a little bit easier than the string back in the mouth. But these little guys, and I've got an image coming up here soon, we're going to talk about these water flossers, and this may be the answer for people. Can this individual wash all body parts while bathing? If your loved one is having big challenges washing all body parts, they are going to have difficulty with their oral care, hands down. Number 4, is your loved one cooperative with oral care provided by yourself or a caregiver, or are they resistant? If they're resistant, that can pose a lot of challenges with knowing that the oral cavity is cleaned properly. So getting additional professional care would be great. And number 5, is your loved one prone to tooth decay? Do you end up getting a diagnosis of cavities each time you see the dentist? When you see the dental hygienist and she's cleaning your teeth, does she always mention that you have bleeding gums? When you brush your teeth, do you see blood in the sink? These are not so good, things to happen. And so you definitely need to look into that and maybe get some additional professional care. So these are just things to think about and consider. Increasing the usage of products. Okay, so myself being a dental hygienist, when I go to the store and I look down the aisles with all of the oral care products, I get overwhelmed. So I'm thinking, if I'm overwhelmed, certainly you might be overwhelmed. There are so many different products out there, I can't even tell you. Some of them are very therapeutic, they're very good, they're helpful, and others not so much. So it is good to see dental professionals because we can guide you in the direction that you need, so you're not wasting your money and you're buying products that actually will help you. But again, Crest Oral-B, a lot of the products have stannous fluoride that's therapeutic. It will help treat gum disease and gingivitis. We have Act-Rinse. I know a lot of people like Act-Rinse. Xylitol. If any of you are familiar with xylitol products, it's naturally occurring xylitol. It's found in tree bark and some plants. It is safe, it's effective, and it helps to, this is one product that we dispense that I love. It's one of my favorite outside of the spry sprays and some of the mints and gums. Xylitol and products, if given or taken in at a therapeutic level, can actually change the way the bacteria behaves in the body. So it's not as destructive, and it will definitely help you prevent decay. I have testimony from patients that also tell me they have less plaque buildup and better checkups. So this is available online by DR Products, and we dispense it as well. So if you need more information, you can Google Xyloclean and you can pull that up too, and they can send it directly to you. But again, also I did find out online recently Toothets. So if you do need, I'm not a proponent of using Toothets because I think bristles on a toothbrush is going to do a much better job. But if somebody wants to dispense xylitol and you're a caregiver and you want to put it along the gum line where the plaque is forming and accumulating, that would probably be very helpful, probably at least 2 to 3 times a day. And it can also help moisten people's mouths. So again, the xylitol helps combat dry mouth, which again causes tooth decay. Fluoride, I'm a big proponent of fluoride. Being a dental hygienist, I use fluoride every day. I promote it because I know what it does and it does work well. If you're not a fluoride person, that's okay. But in dentistry, we do have toothpaste. We have home fluoride that's a prescription you can use if you're struggling with tooth decay. We have varnishes that work really well that do stay on the teeth for up to 4 weeks. So I have a lot of folks that are prone to tooth decay that cannot provide adequate oral care for themselves, and we're using a lot of varnish to help them, and I see good results. Fluoride can also kill bacteria, so it has a lot of different benefits. Antibacterial rinses. You may like some of these things. Paradex is a prescription, and it does give bacteriostatic benefits where it kills bacteria up to 12 hours, typically given twice a day, morning and night. That is if you do have gum disease, that might be prescribed to you. Otherwise, there's all kinds of different Crest Oral-B, Listerine, there's all different kinds of products. But be very careful to look at the labels because Listerine has almost 27% alcohol. If you have a dry mouth, you do not want to use anything with alcohol in it because it will make your dry mouth drier. And we don't want that. Okay, water picks, tools, electric brushes. I'm going to hold both of these up because the water pick is where it's at. These are amazing. They have improved over the years. You can see that I can grasp this pretty easily with my hand, whereas grasping a small toothbrush is pretty tedious. And believe it or not, as long as you get the reservoir filled with water or a liquid that you might want to utilize, you could get kind of a small basic basin or just a plastic tub. And you may be able to even do this if you're sitting in your electric wheelchair or in bed. I have lots of folks that I instruct with this, and they are so happy because the water pick does a beautiful job. It's a replacement for flossing. Yes, I said that, but it does do a beautiful job. It's much better than no flossing or brushing at all. Also, I wanted to mention electric toothbrushes. If you've never tried one or don't have one, now might be the time because they do a much better job than just traditional manual brushing. They have the ability to sweep the plaque from below, slightly below the gum line. They treat gingivitis, prevent cavities, lots of different types on the market. I like the Crest Oral-B because the brush heads are soft. They're less expensive than some of the other ones. They're readily available. And I like the super soft. That's much kinder to the gums and the teeth. And very therapeutic. I can't say enough good things about these devices. Lots and lots of different devices on the market. Again, increasing access for care. We have the physical and cognitive challenges or constraints, bringing the providers to you, making it easy for you to receive care, increasing the numbers of folks doing this type of thing. For us being mobile, not only are we battling the traffic, but we're battling the heat. So there are some challenges, but some definite benefits for our patients. And again, continuing to educate our population is very important. So I just wanted to say thank you for listening, being a great oral health advocate, and choosing to make a positive impact on your health. Thank you.
Thank you for that great presentation, Ann. My hygienist has been telling me for years that I need to switch to a electric toothbrush, and I've been resistant because I don't like the way it feels. So you've made me a believer now.
Oh, that's good. They're great. They really work well.
I've got a couple questions. We're running a little short on time, so I'm going to breeze through these questions pretty quickly.
Sure.
Let me see.
Also, I did include my phone number and our website, which also includes an email address. So if anyone has any special questions, and they can call me directly too.
Okay, and those will also be on the handout. So if you didn't have time to write it down as I'm flipping through slides, we'll make sure to get that information to you. Okay, someone asked, I don't need mobile care at this time, but I wonder if you work with the VA. They do the initial exam and then assign me to a local dentist to do cleanings and care from then on. The VA pays any charges to the local dentist facility. So do you accept VA benefits?
As far as I know, we do. We also are contracted with the state of Arizona. And so that would be with Altex, as well as we're currently jumping through the hoops and getting credentialed with, I believe, Mercy Care and another UHC plan. So we take other UHC plans as well that are popular.
Great, thank you. Amy says, I would like to discuss something called an air flosser as opposed to a water flosser. Are you familiar? Can you talk a little bit about the difference or what your opinions are?
Right, an air flosser is just that. It shoots air between the teeth. So if you would have difficulty utilizing a water flosser with water, which I can understand, that may be helpful. However, as a dental hygienist, I would